this is going to completely revolutionize skin cancer surgery. If you get a device like this is going to be a game changer. This goes into
Very
a small
superficial.
circular area. It's usually 6 millimeters thick, and it's painless. It's non-invasive. There's no recovery. There's no complication. Well, I think too, we should all really try to live in the present, right? And enjoy the present, right?
Yeah.
And if your present is to be single and enjoy yourself, then do that. Or if your present is to be with that person that you're supposed to be with,
Be in the moment. Welcome back to Skin Self and Everything Else. I'm Brandon Mitchell.
And I'm Dr. Ellen Turner.
Dr. Turner, what'd you do this weekend?
Well, if I told you, I would have to kill you. No, I'm just joking.
So funny.
I did have to do a business trip to New Jersey, and I got to go to Kenfield, which is really cool. But on Friday night, before I left on my business trip, I actually went to a comedy club or a comedy show.
Was it fun?
It was. It was fun.
Was it funny?
It was funny. And I couldn't tell you the comedian's name. It's this long Japanese name. And then the opener was this funny gay guy out of LA. And then, but before that, we went to this really good Italian place called La Stella Cucina. They have like homemade Italian pasta from Italy. So you know my adage, if it's Italian flour, it's essentially like not processed. You can have it.
I was about to say I wasn't gonna call you out, but I was in my head. I was like, oh, so
It's not modified. It's not modified.
So you did the right thing.
Yes, it was delicious. You should go there.
I'll try it. I love Italian food.
Yeah, it's yummy. It's totally delicious. So what about you? What did you do this
I'm embarrassed.
weekend?
I didn't want you to ask me. I told you not to. You did it
I
anyway.
want to know. Let's tell our viewers.
I went to Six Flags again. Can you believe it? I'm embarrassed to say it. People out there are going to go, God, does this guy have a life? What is he, 5 years old?
They need to know the real Brandon.
Well, that's me. Hi. Here's the thing is like my brother, you know, we hang out a lot. He lives 3 miles away from me.
Yeah.
He's like, and he's 4 years older than me.
Yeah.
Sorry, Brent. I think 3 years older. I'm sorry. I think it's 3 years older. Sorry. But
so y'all are children at heart?
We are. And so he was like, it was beautiful weather. You know, it was like the high was 70.
Yeah.
So pretty outside. So we went to that Fright Fest and I went through all those haunted houses and thought I peed my pants like 4 times. And I would like to introduce my third ass that I got from eating
all those
I kid you not.
What'd you eat? Tell me some samplings.
Okay, here goes. I had chili cheese fries. I had a slice of pizza. I had onion rings. I had a pineapple float.
Did Brent partake in any of these? Like, did y'all share these?
He did. And I.
Oh, okay.
No,
so y'all did
and
share.
Literally, I put on a pair of shorts yesterday.
Yeah.
Tight.
You couldn't.
And then I went and weighed myself. Now I'm depressed.
Oh, stop.
No.
Stop weighing
So
yourself.
now I'm going to have to. But honestly, it was fun hanging out with him.
Yeah.
I mean, you know what I'm saying? It was fun. We had a great time. We laughed a lot. It was fun acting like kids. But that's twice in a month. Seriously, I'm 47 years old.
Hey, that's what, I guess Fright Fest is for.
It was fun.
Yeah. Yeah. So,
But I am getting a little too old for that suspense.
Yeah.
You know what I mean? Had a little backache the next day. I don't know if it was from somebody chasing me or running. I don't even know. But, it's really fun and go out there. So we should do it next time we do a podcast live out there next time. Golly. Do you like that kind of stuff?
Not particularly. I did when I was 15.
See, there we go. That's why I didn't want to say anything.
Yeah, but no, that's fun. That's fun.
It was fun. So that's about it. And then now I've got to go to the gym right after this podcast.
Yeah.
Get back, because
kind of get back in the mode, get back in your routine.
Well, that Halloween's close and they have all the the Halloween candy out at all the
Oh
stores.
yeah, and you're a sweets guy. So am I. I'm all into
I'm
sweets.
addicted to these. I'm
Show
on a
me.
Reese's kick.
Yeah,
And
I love Reese's.
But now they have, listen, all the Reese's dipped pretzels.
Oh, I can't do that.
Now listen, and now I'm addicted to the Reese's dipped animal cookies.
Oh, I can't do that.
I'm washing them down with a ginger ale soda. No wonder these I can't. But I'm like, I'm going to go ahead and allow myself to have me a little animal cookie tonight, right?
Right.
And here I am having like 6 or 7 a night, washing them down with soda, and then I complain that my pants don't fit. Anyway, how do you... This is the first time I've done a podcast in pink scrubs, is it?
They're so
no,
cute.
I did it.
No, you did it last
I did it last week.
So
But
cute.
aren't they cute?
They're so cute.
Breast Cancer Awareness October.
love
You
it.
got to show the love.
I love
You know, a woman stopped me and she says, "Only real men wear pink." And
It's
I was
true.
like, "God, do I have you fooled?" Gosh.
Only confident men.
No, only confident man, honey. Only confident man. But so this is going to be a great podcast, and to be honest with you, I'm going to get a lot of education from this.
Yeah.
Because, you know, me and Lauren being on the aesthetic side of things, I don't always get to be involved or know everything on the clinical side. I kind of learn as I go.
Yeah.
And so being back in dermatology with you for the last year and a half, I've really built up my knowledge again because I kind of got foggy because it had been 10 years since I worked for you before.
Yeah.
And so when I worked for you before, you didn't have this device that we're fixing to discuss.
Yeah.
And I'm not going to get too much into it because it's going to be your floor, because I'm going to be learning as you're talking, because there's a lot about this that I do not know. But we're going to be talking about single radiation therapy. Did I even did I get it right? Did I get it wrong? Did I?
We're going to talk about, well, first we're going to talk about.
Did I say it right though?
No, it's superficial.
That's what
That's okay.
I said single radiation therapy.
It's superficial radiation therapy. Superficial is key because we're going to be talking about why it's different from regular radiation.
I really thought it was single.
That's okay. That's okay. It's okay.
You learn something new every. I told you
do.
I'm learning as we go.
Yeah.
So,
and as a way to treat skin cancer. So I think maybe we kind of talk first a little bit about skin cancer in general.
well, yeah, because what I do know is it is a non-invasive, non-painful way to treat it.
Yes.
So you're going to tell us a little bit about, you know, the different types of skin cancer. Is
Yeah.
that what you want to talk about?
Yeah, let's talk about that.
I want to know.
Because I think there's different types of skin cancer, but this device is really geared to treat more the squamous cell skin cancer and the basal cell skin cancers, which are what we think of typically as caused more by sun exposures over time. And I think, you know, if you think about your cumulative life exposure, you know, we start getting sun exposures when we're children. And we probably haven't always been good about having very good sun protection.
Well, when we were kids, sun protection was non-existent.
Exactly.
Baby oil and iodine.
Exactly. Well, I mean, that's the kinds of activities we were
Right.
participating
I'm saying that's
in.
what people
Yes.
were doing, but we didn't
Yes.
even really have sunblock on the market.
Exactly. Our generation, and think of the ones before us, right? So a lot of the patients that we treat now have had really kind of minimal options. So it's like you can either do things like surgery, maybe topical creams, or these what's called an EDNC, which is a scrape and burn kind of procedure. And, you know, I think if you're somebody who's had a lot of sun exposures and you do now have either basal cells or squamous cells as a result of sun exposures, especially living in a state like Texas, which we have people who've either worked as farmers or ranchers,
Construction
or
workers.
oil field workers, anything that is a sun exposure kind of profession, roofers, anything like that. But I think at some point, these patients just look and say, is there anything else besides cutting? Is there anything that you can offer me? Because surgery is definitely something that not only do you end up having a recovery period, but there are risks associated with surgery. You know, you definitely will have pain surgery.
Mm-hmm.
There are complications that can arise. We don't like to talk about that, but there's the possibility that complications can occur.
Mm-hmm.
You can get infections, you can get hematoma. It's invasive. We talk about things that, you're having to undergo the possibility of, you're opening up the skin, and with that comes possible
Right.
issues. So, about 9 years ago, 10 years ago, it was back in 2014, I believe it was. I was at a meeting at Texas Dermatology, and that's where I first came across this superficial radiation therapy device. And it was really kind of a profound thought, because as a resident, we were always trained that to treat skin cancers like superficial and nodular basal cells and squamous cells, even invasive types, you really should not use radiation. The cure rate is not the same as surgery. So to think about a non-invasive, non-painful type of therapy, such as radiation, I had to really question it. So I'm talking to this person at this radiation therapy booth, and then I see my pathologist across the way, and I said, "Can you just hold on just a minute? I need to go talk to my pathologist." So I went across the way, and I was speaking with my pathologist, and I said, "Todd, what do you think about this therapy? I mean, it's superficial radiation, so it's completely different." And at the time, the cure rates were right around 95%. So right equivalent
Mm-hmm.
with Mohs surgery, which is the gold standard for skin care or for skin surgery. And he said, this is going to completely revolutionize skin cancer surgery. If you get a device like this is going to be a game changer. And so I was totally convinced at that point. So I got my first superficial radiation device that year. And then a year later, I got my second device. And so I've had these devices since that time. I've treated thousands of patients. These patients have one thing in common. I've never had a patient that regretted doing superficial radiation surgery. I've had other patients that come to me after I've made the recommendation for radiation, and then they've chosen to go the surgical route, but they've regretted that decision. They've said, "You know what, you told me that I should do radiation, and then I went against your medical advice, and I went and did Mohs surgery, say on my nose or on my shin, and I really regret not having done that advice that you said, go on and do radiation, superficial radiation," which is
Right.
different from the radiation that we get when we say have a patient with breast
Breast cancer, yeah.
or a patient with radiation or with prostate cancer
Right.
or something like that. This is completely different. So this goes into
Very
a small
superficial.
circular area. It's usually 6 millimeters thick, and it's painless. It's non-invasive. There's no recovery. There's no complications.
Is it a one and done, or do you come back for a?
Unfortunately, you do need to come for several treatments depending on the location or the site. So typically, like if it's on the nose, you might have to come for anywhere between 17 to 19 treatments. But literally, these treatments take 40 seconds to do the actual
Correct.
treatment. And now with the cure rates, we have a radiation oncologist now that we consult with, and we have a radiation tech that actually performs the treatments too. So now we have a team. We have a board certified dermatologist. We have a board certified radiation oncologist. We have a radiation technologist. So you have a team of 3 people working together. And now there's even additional techniques that the radiation oncologist employs, like hyperthermia, where they will heat the skin up to make a better cure rate for just the skin treated area. And now your cure rates are up to between 97 and 99%. That's actually even better than Mohs surgery. And again, no cutting, no scarring, no invasion. So, our referral out to Mohs and just to regular surgery has significantly dropped over the last year because of this. And patients love it.
So
Patients
there's
love
no
it.
scarring from this treatment?
There's no scarring. You have to, of course, perform a biopsy whenever you suspect
Yeah.
there might be a skin cancer, because you have to get tissue to prove what kind of cancer it could be,
Right.
and that it is a skin cancer. But
Mhm.
after that, there is no markings. There's no scarring whatsoever.
Do you ever have patients that whenever you're doing like the consultation for the radiation therapy that are very apprehensive because of the word radiation?
Yeah, that is a great question. And again, because that word, it is a form of radiation. But what I like to explain to those patients in my own way, I love to use analogies. And with radiation that we think of for like breast cancer or prostate cancer, if you took one of those 5-gallon buckets of paint from like Lowe's or Home Depot, if you put a patient through that kind of radiation, that's how much radiation they would require. If we're using the radiation, that's superficial radiation for a basal cell cancer, for example, on the nose, and they went all the way through the entire treatment course, it would be like taking a single droplet of paint out of that paint bucket. That's how minimal the radiation exposure
That's
is
good
that
to
we're
know.
talking about. So it's not even comparable. And that's important to know when you're thinking about lifetime dosage of radiation. So people that are scared of that word or scared of, side effects from radiation, I mean, there are none, because it's just going in that circle of treatment. It's only going skin deep. There are no other side effects because it's not remotely like radiation in that sense of the word that we use. I wish it didn't even have the name
Right.
radiation
I'm
in
not
the
going to say,
word.
I'm like, we probably get more radiation walking under a power line.
We do.
Honestly.
Actually.
Or sitting around your lights,
If you really
honestly.
start to look at the amounts of radiation that you get, for example, flying on a plane and going up in the sky that close to the sun, you are. I mean, you need to learn this as you become certified in these, radiation devices. Fortunately, I am no longer my radiation safety officer. I have Dr. Agarwal, who is my radiation safety officer. But, that's the interesting thing, is that I think most people aren't even aware of how much radiation they get on a regular basis.
What is your typical reaction from a patient at the end of therapy?
Oh, you know what? My patients are so incredibly happy
Are
that they
they?
actually did the treatment,
They
because
are.
it's such an easy treatment. And our radiation therapist is named Rondi,
Uh-huh.
and Rondi is so pleasant. She's so wonderful to work with. Patients love her. And, nobody wants to go through a treatment where you have to go twice a week for a 40-second treatment. It takes longer to get to the actual clinic
Right.
than, it takes to do the 40-second treatment. But we try to make it a really quick process, that once they get to the clinic, they immediately are pulled back. And, we try to make it nice in terms of having a little coffee station there for them, and they can have a little morning coffee while they're here. Just make it a pleasant experience.
Well, there you go. You learn something new every day. And just FYI, it is not single radiation therapy. I cannot believe.
What is it?
Well, hey, at least I was honest. I'm
Superficial.
like, and you know what? I probably said that 10 times for the podcast. I'm still going to demolish it. But here's the thing: is it's like it's good to know. It's very informative to me, because I hear you guys talking about this all the time. And I mean, I knew some things
Yeah.
about it, but this is very interesting, and I'm sure there is thousands of people out there that did not know about this that would love to know that there are more options out there than being cut on.
Just being cut on.
Yeah, and
the other
having
thing,
bad scars, especially on your face.
Yeah, absolutely. I think the other thing I would say about it is there are some particular areas that I really like for patients to think about. One is, like you said, the face, the ears, the shin, like where it's really tight, there's not a lot of good tissue. The backs of the hands, which are an area that oftentimes it can easily get infected.
What about men that have hair loss? I'm sure you see a lot on the back of on their crown. Do you ever see a lot of that?
All the time.
Because I never put sunblock back there. I forget all the time.
Brandon.
I forget all the time. I don't think about it because I've not always been this bald. But
you have to consider that because otherwise you're going to be looking at a lot of sun damage. So definitely you want to use sunscreen there. Definitely you want to use hats there, especially like when you're going out for Six Flags fun.
The problem is I can't find a hat I look cute in.
Okay, well, we need to
work on that. Walking around bald looks better.
Stop!
I can't.
What about a cute little helmet?
I cannot. Seriously, right? I'm very, 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 very picky about my hats. My hats, because they have to bend just right.
Yeah,
and don't get me wrong, when I find the right one, I rock that thing.
Yeah.
But I can't find the right one that I like. Honestly, I'm making excuses.
No, we need to find you the right one.
Or just wear sunscreen on my damn hat.
I was going to say, or just get a good sunscreen. Yeah.
But no, I need to find me a cute hat. Will you go shopping with me?
Yes,
okay.
I would love that.
And then the thing is it's like you try them on at the store.
Yeah.
And what little hair I have left, girl, I cannot be walking around the rest of the day looking like a hot mess express with my hair everywhere after I try on these hats. The things I say and do, I swear.
We need to get you hatted up.
We do, and sunscreened up.
Yes.
Very informative. I love, 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 love talking about this. I'm excited that I know more about it now. This is good information.
So let's talk a little about self and something you had mentioned to me about a quote.
I was watching, I allow myself, I have designated scrolling time.
Yeah.
And I do not scroll first thing in the morning.
I think that's so wise. I think that starts your day out it's in a bad way.
Well, because there's a lot of negative stuff that you come across scrolling, and a lot of bad news, a lot of bad press, a lot of bad everything, and then the stuff, remember the days of social media, remember the days to where we weren't exposed to every single thing that's happening?
Yes.
Now every time somebody has a fight, every time anything bad happens, people always have their phone and they capture this, right? So now everything is exposed. Mm-hmm. My point being is it's like starting my day off with that, I can't do that anymore. And I can find myself not being productive, sitting there I'll be scrolling and it's an hour later and I'm like, I'm still scrolling.
Yeah, no.
Because can we all agree that time goes by so much faster when you're doing this?
It's wasted.
And so the thing is it's like, but anyway, my point with that, here I go off to the left again. Let me reel myself back in. This is not a social media lecture. But what I'm saying is that when I do allow myself some time to scroll, which is always about an hour before bed.
Okay.
Not right before, an hour before, I came across Drew Barrymore, and it was showing a clip of her show. I love her. Number one, she's been around since I was a kid.
Yeah.
And number two, she doesn't have a bad bone in her body.
Yeah.
She's so sweet. She's so genuine. She's so nice.
Yeah.
And I've never seen her act any different.
Yeah.
But she was saying, she goes, to all of you single people out there, and so that definitely got my attention.
Yeah.
She goes, everybody wants a partner. I mean, we all do, right? We're put on this planet to be partnered up with somebody. We're not meant to walk this world alone. Sure. And it's okay too.
Yes.
Right? Because things happen.
Yeah.
But we all want, to have someone to lean on, to grow old with, or do all the things with.
Yeah.
But she says, don't constantly sit around wishing that you had a partner, because there will become a day to where someone is going to be there and you are going to meet that special someone.
Yeah.
And then you're not enjoying the time. You missed out on enjoying the time that you had to yourself.
I think too, like, I agree with that.
And
by the way.
that's profound to me because it totally, in that one instant, like I completely, a light bulb went off and I was like, she's totally right. Like I should be, because you know how we all get in a relationship at times, you're like, God, I wish they would get out of my hair. You know, seriously. Or you're like, you know what, you wish for that. Everybody does it, but you wish for that alone time.
Yeah.
I don't want there to become a day to where it's like, I'm with somebody and I'm going to look back and say, God, remember when I had that time to myself? I wish I would have enjoyed that.
Mm-hmm.
So,
well, I think too, we should all really try to live in the present, right? And enjoy the present, right?
Yeah.
And if your present is to be single and enjoy yourself, then do that. Or if your present is to be with that person that you're supposed to be with,
be in the moment.
Be in the moment with that person.
No matter what the moment is, no matter what, be in the moment. Yeah. Because, you know, I had to reel myself in last night. I started going down that fearful train.
Oh, yeah, no.
I was like, I was walking my dog and I was started going through all, you know, processes and fears. Yeah. And then I was like, you're supposed to be enjoying a walk with your dog.
Yeah. Don't do that. Like, don't get in your head. Yeah.
And it's like, you know,
you're going to miss out on all the good stuff.
You are. All the moments that are having.
Great presence.
I went for a run on Saturday and I almost died, by the way. Will you check my pulse? Because I think I might actually be dead. Look, seriously. I'm telling you now.
There's this darn, I'm not going to say DNA, but this darn rubber
I know.
that you're allergic to.
But let me tell you something.
You're still alive, by the way.
What'd you say?
You're alive, by the way.
Thank God. Because let me tell you something. Running on a treadmill and running outside, it's not the same.
No, I've heard that.
No.
I can't.
So I went for a run outside because it was a gorgeous day. And then after I got over my heart palpitations and feeling like I was going to faint and all the things, I swear to you, I was walking in the biggest owl I've ever seen with wings out. What? Was like from here to that door for me, and it flew in front of me. And I was like, what? Because, you know, I live across the street from a nature preserve.
Are you sure it wasn't a Halloween decoration?
It was an owl.
Wow.
It flew right over it flew off this person's fence, went across Plano Road, which is the road I live on. And then it went into the nature preserve. And I was like,
cool.
If you're worrying and you're distracted, you're going to miss that kind of stuff. You got to be in the present.
Sounds like a sign.
What of what?
I don't know. Something good.
Oh my gosh.
It's something good.
I would have thought it would be maybe. Isn't it something good if they poop on you? He didn't poop on me. Isn't that a thing?
Stop
like
it.
He didn't sling any poop on me. Like there was none of that.
I think it's something good.
Okay, I hope so. Well, it's my point being is that if you're walking and you're not in the present, you miss things.
You might
like
have missed that.
It was incredible.
Well, you didn't miss it.
It was incredible.
Yeah,
it took my mouth was open for about 4 seconds. I was like, oh my gosh. But anyway,
crazy.
This derm trivia that we're fixing to do here.
Well, first, what is our favorite?
Oh yeah.
What is your favorite restaurant? Because I finally went to one that you've talked about.
Bobby's Airway Grill.
I went, and then I went again.
It's amazing.
What a great place.
A friend of mine introduced me to that place. And for those of you who are in Dallas, the Dallas-Fort Worth area, it is off of Preston and Royal.
Yep, it sure is.
And it's in the shopping center. It's where that old...
that's what I was going to say. It's where the old Dougherty's Pharmacy used to be, and then they redid it.
And it's funny because after Mark told me that, I drove by and saw the new pharmacy that's off 635.
Oh, okay.
I saw 635 in the Preston. I saw... Anyway, but that... a friend of mine told me about that and took me there.
Yeah.
Great food.
It is great food and great cocktails.
Great atmosphere.
Great atmosphere.
If you're single out there and you want to go and not feel awkward, but yet you want to mingle and you want to sit at the bar.
Yeah.
Excellent bar for that.
They also have a little outdoor area.
It's amazing.
Yeah.
Do a little shopping when you're done eating because it's in a strip mall.
It has all these little shops.
Yes. I went walk around and shopping
so
after
impressed.
I ate. And I'm so glad.
Yeah.
Finally, I got a restaurant. You didn't like Steak and Shake? We didn't do that.
Didn't do that yet.
You didn't do Olive Garden?
Didn't do
like that?
Yeah, the endless bread basket.
Oh my God. Can I have a basket of gluten, please?
Let's do that. Hey, but seriously, I've already talked to Stacey Lee via text today, and she wants us to all three go to the. Well, Mark can go too.
To Bobby's?
To Bobby's, yeah.
I hope so. I love Bobby's.
Yeah.
I'm telling you, Bobby's is the place. And the prices, it's not astronomical.
It's not astronomical.
No, it's really good.
I think
I'm
it's
in love
reasonable.
with it. I had that spicy chicken sandwich when I went.
Oh, I saw that. It looked so good. And the burger looked good. I did not get it, but my friend did. Yeah.
Now that Mark talks about the shrimp cocktail, I'm going to try it.
Oh my gosh, delish. Okay.
And so what is your favorite product of the week?
Oh gosh, I know I'm going to sound insane, but I've been pumping my TNS in with this oldie but a goodie product. Do you remember that Odd Rose that we used to carry?
Yes.
I found 2 bottles of it.
Did you?
I did. Y'all, this is a product that has CBD in it, and we used to carry it, and it's just, it's a more of a decision, honestly, and we'll talk about this. We'll do a whole podcast about how you make decisions about carrying product. But
that's a good podcast.
That's what I'm saying. You and I are going to do that podcast. But the bottom line is it's a dang good product, but it's just, we just can't carry all these products. So anyway, I found those products and I started squirting them on, and it's like, oh yeah, I love this product. It's such a great product. But anyway.
I'm going to need everybody listening right now to give me an applause. Let's do it together. Because you remember that podcast we were talking about, the V mask?
Yeah.
I sold one.
Hey, is that your product of the week?
No.
Oh.
I'm just saying. No, that's not it. But I just wanted to give a little self shout out that I was like, you know what?
Fist bump.
Yep. I'm telling you, women love that product.
Yeah, they do.
And then they come back to buy more. And the staff loves it too.
I love it.
Rejuvenates, hydrates, all of the things in the private parts, right? It does. It's amazing.
It is good.
So, but anyway, I remember on that podcast, I was like, I'm going to need someone to, I think someone listened.
Yeah.
I'm hoping that's what it was.
And got it. Yeah. Well, what's your product of the week if you had to pick one?
Oh my gosh. Honestly, I'm in love. Can I pick just one? It's just one. Can I?
Just one.
I'm in love. Really?
Yeah.
Okay. I'm in love with, I don't know if I can, it's any HA5 with Cosmetic.
Oh, yeah. Because, you were talking about, you like that spray.
I'm in love with it.
Yeah.
Because, now they've got that new lightweight moisturizer. They have that new foaming cleanser. They've got the HA5. I'm loving the whole HA5 line.
Yeah.
But if I had to choose one out of all the new HA5 lightweight moisturizer, I love it.
Nice. Yeah.
It's lightweight. It's non-greasy, hydrating, plumping, all of the things.
Yeah. It is a great line.
Yeah. So, yeah.
I'm excited. All right. So the reason I chose this trivia of the week, I'm going to say it because I just wanted to teach you how to say it because it's hilarious. I like this.
Do you know I read this?
And you were like, no, I can't, she's not going to make me say this, right?
No, literally, I go like this. I was like, I think she made it. Can I try to say it?
Okay, try to say it and then I'll teach you. Try to say it.
Congenital, right?
Yes, you said it. And
congenital and reticulated papillomatitis. Wait, hang on. You know me. Papillomatosis. I can't. Okay, yep. The next word, not even going to try it. What is that? Garrote?
Okay, so I'll just tell you how it's pronounced. So it's basically congenital and reticulated papillomatosis of Gougerot and Carteau. And when you learn how to say that as like a first-year dermatology resident, you're like, I know this, I know this condition. And it's like, so you
Why do y'all name stuff so weird?
It's hilarious. Like, it's like this long thing, and you sound like you're so, like, smart, and it's like, so say it. Like, I'm going to make you say it, so you sound like you're so smart.
Say it one more time.
Congenital and reticulated papillomatosis of Gougerot and Carteau. Say it.
Oh my gosh, I'm scared. Congenital and reticulated papillomas. I don't know.
Papillomatosis.
Say it one more time.
Papillomatosis.
Papillomatosis of
Gougerot
and Carteau.
You did it.
And right after you get that, go get your single radiation therapy.
No.
No, it's not single. It's not single.
Anyway, it's just a little lacy brown rash. You used to treat it with like oral minocycline. Now I've found it's very responsive to topical minocycline foam. So anyway, that's our derm trivia of the day.
That is some derm. Do you see a lot of this?
No, not so much. But when you do see
Next
it,
time
you know exactly what it is.
Next time you see it, go, I'm going to go get my esthetician to come in and tell you what this is.
Yes, I'm going to get my trusty assistant.
And I'm gonna,
he will tell you what it is.
And I'm going to walk in the room and go, girl, you got the car.
That's right. That's what we call it. That's what we call it.
That's what I'm saying. Yep, you got a little bit of the car. All right, so now... that's it.
Yep.
We did it.
That's a wrap.
We did the trip. That's a wrap. This was great.
This was
great.
good.
We decided to do this last minute. I think it's good because we need to get the word out about SRT because it is fabulous and I don't think everybody knows about it. Not everybody has to go get all that surgical and invasive
That's right.
things done. So
That's right.
Anyway, thanks everybody for joining in another week of Skin Self and everything else. And always remember, you providers out there, please go to drellenturner.com, like, subscribe. But we've got a newsletter on there.
Yeah.
All the things. There's so much information, so much informative information. We're about to add new videos this coming up weekend next week. So please remember, I always say this because it's real easy to... think about it this way, is that the price of it to subscribe is less than a syringe of filler.
That's right.
And it's good for a whole year, unlimited access to the video. So everybody, all you providers new outside of school, that's where you're going to start. Go to drellenturner.com. And thanks everybody for tuning in. And we will see you next week.
See you next week.